Hello, my name is John McConnell. I'm a doctor. I was originally a general practitioner for a few years in South Africa, working at the Groote Hospital, and I subsequently moved over to the United Kingdom and trained as an ophthalmic surgeon, which I've been doing now for many years. And although my special interest was retinal detachment surgery, I have become more and more interested in the management of chronic degenerative diseases, many of which affect the eyes. And I have now developed a way of managing degenerative diseases, not so much treating them, but trying to prevent them occurring, because the treatment, although it's not terribly effective, it is terribly expensive. For instance, macular degeneration, which is one of the more common degenerative diseases affecting the eye. There are two forms. One is the so-called wet variety, for which there is a treatment, but this treatment is terribly expensive, costing upwards of £20,000 per eye per year, and therefore it obviously makes a lot of sense to try and avoid it happening if this is at all possible. The other thing, of course, is that by the time you come to have your wet macular degeneration treated, a lot of the damage has already been done, and that will not be reversed, although it may well prevent further damage occurring. But far more people with macular degeneration have the so-called dry variety, for which there's no known treatment, although it is known that there are certain risk factors which will aggravate the situation. The most important risk factor is possibly genetics, but of course you can't choose your parents, so you can't do very much about your genetic makeup. In any case, the genetic aspect is not very prominent, and there are far more important risk factors about which one can do something. One of the risk factors is the effects of sunlight on the back of the eye, and wearing dark glasses or a wide-brimmed hat will certainly help up to a point. Smoking is probably the most significant single risk factor, and therefore giving up smoking will make a big difference, but that of course can be quite difficult. Recently it has become more and more obvious that probably the most important factor in ameliorating the condition is dietary, and there is a lot of evidence that a good diet, a plant-based diet, will delay the onset and perhaps prevent progression of macular degeneration. With this in mind, a lot of bodies looked at the role of vitamins, and it was found through a very good and important study in America, the so-called age-related eye disease study, that combining a number of selected high-dose isolated vitamins did play a small role in slowing down the progression or preventing macular degeneration occurring. The problem is that it was then found that these high-dose vitamin supplements were actually having quite a few adverse side effects, and there are cautions about taking them. But at the same time, the people recommending supplementation realize that we do need to take in a lot of antioxidants, not necessarily in the form of vitamin pills, which are usually synthetic, high dose, and have quite a few side effects. But the best way really to obtain your antioxidants is through your diet. And antioxidants are provided by a plant-based diet, and that's why it makes so much sense that people should be eating a lot of fresh, ripe fruits and vegetables. And there's a lot of evidence that this will play an important role, perhaps not in preventing it entirely, but certainly preventing an early onset of macular degeneration. And there's a lot more evidence to show that progression of the macular degeneration will be slowed down by this plant-based diet. So my recommendation for many years now has been to my patients not to use synthetic vitamins in high doses, but simply to try and have a diet which is based on plants and this is something which anyone can do. Okay, it can be a bit difficult to do it, but most people can increase their intake of fresh fruits and vegetables. And you know something, people really like to be able to think they're doing something to help their own disease process. And at the end of the day, prevention of macular degeneration is much more satisfactory than treating an established condition.